We have a very nice 69-year-old woman who is here for thread lifting. So what is thread lifting? Thread lifting is a dissolvable suture that has microscopic little fish hooks on the suture. I can put it underneath her skin and elevate the skin to hold it into position. In fact, she's already had thread lifting done to her forehead. Her brow area here was down low, folding over the skin, and about 6 weeks ago, we used a couple threads to hold the brow in the elevated position. These threads are unique in that they dissolve over about 6 to 10 weeks. And when they do, the collagen strands that are formed around the threads before they dissolve hold the skin in place for 6 to 12 months. Today, we're going to be putting 2 threads into the cheek area, 2 threads into the lower face area, and at least 2 threads into the neck region. Her face has been all cleansed. She had a couple Tylenol before she got here today, so that should help make it more comfortable for her. And she's graciously offered to be filmed to help educate you about how this is done. All right. I'm making a mark where I want the thread to go into the skin, and then a mark where I want the end of the thread to be. And that will be our 2 cheek lift. This will be the thread for underneath the jawline. And then one for the neck here. Since she decided she actually wanted both sides of her face lifted today, we're going to make marks on the other side too. It's not uncommon for the left side of the face to sag a bit more and have more wrinkles than the right side, because this is the side that's facing the driver's window when you're driving your car. So there we have it. We have 2 for the cheek. We have 2 for the lower face. We have 1 in the submandibular region, right underneath here, and 1 in the neck. So really the only uncomfortable part of this procedure is when I put a couple drops of lidocaine into the skin at each of these white marks. So I apologize ahead of time, this stings just a bit. So that's one set, and now we're going to do these. Okay.
Okay.
Now we're going to give you about 5 minutes to let this kick in, and then we'll do the exciting part. Okay. At least the exciting part for me, because I get to see instant results. Welcome back. It's been about 5 minutes since I put a few drops of lidocaine at each one of my white marks. People ask how you get the threads in. Do you need an incision? The answer is no, you don't need an incision at all. In fact, we just use a little hypodermic needle to make a tiny poke in the skin, right where she's numb, so she shouldn't feel any pain from this. And let me go over to this side. So that's all the incisions that we use for a thread lift. And now the magic happens. We will start the magic part of the procedure. So I have the little trocar down to here, and we just hold it there and pull the thread out. And while I hold pressure on the thread there, we can massage the skin up. So we have the 2 cheek lift threads in place. You can already start to see that it's changing the position of Jean's cheeks. So we have one side done. All right. So we've already done the right side of the face. Now we're going to do the left side of the face. And that is it. Now, The results from this improve over about 6 weeks. So really the ideal time to evaluate how well it worked would be 6 weeks from today. The little bit of indentations that you see usually go away within 2 days, at most 2 weeks, but usually 2 days. And it's smooth and obviously is already an improvement over the before thread lift. The threads, when they dissolve, actually build collagen into the tissue, also rejuvenating the face and helping with resolution of some of the finer lines. Usually the only thing required after this is a couple Tylenol. She already took hers ahead of time, being always prepared. Welcome back to Ageless Impressions. This show is about thread lifts. This young 50-year-old woman had a thread lift done for her cheeks, lower face, and neck approximately 6 or 7 weeks ago. She comes back today for a little minor touch-up of the lip. Now the lip has the white lip and the red lip, and right in between is something called the white roll. The white roll is something that unfortunately we lose as we get older, and that's what gives the appearance of a flat lip. The white roll is what causes your white lip to curve out before going back into the red lip. The women viewers will understand what I'm talking about as they use lip liner. The male viewers have no clue what I'm talking about, but that's okay. It'll still be interesting. Approximately 6 weeks ago, this patient had the dissolvable threads placed along the white roll of her upper lip and 3 of them along the white roll of the lower lip. These threads are very skinny, and you need to insert them about 2 or 3 times, spaced about 6 weeks apart, to stimulate your body's own collagen to create a natural white roll. She already has a good result from the first set of threads, and today she comes in for the second. She's had numbing cream put on her lips for the last 45 minutes, so hopefully this will be a pain-free experience for her. Okay, so we will start here, and I will thread it right along the white roll of her lip. And you can see where the point of the needle is. And then we just pull this out. And that's one side done. Almost done. Great. So those are the 2 threads for the upper lip. Now we're going to do the 3 threads for the lower lip. Open your mouth again, please. Great. Then we do one centrally. And that's it. As the threads dissolve over the next 6 weeks, they'll stimulate collagen formation, and she'll have even a more pronounced white roll definition between her white and red lip.